Dr. Chamberlin. I'm a spine surgeon at Uniontown Hospital.
My name's Dr. Pedro Aguilar. I'm a neurosurgeon who specializes in spine surgery here at WVU Uniontown.
We do surgery on necks and backs, take care of patients who have degenerative problems of the spine, tumors of the spine, infections of the spine, and trauma.
The most common conditions that I take care of are typically spinal stenosis, disc herniations. When you hear of spinal instability, either of the neck, the cervical spine, or the lumbar spine, the lower back. And so most of my practice is diagnosing that and obtaining the correct imaging, and then discussing the treatment depending on what the problem is. I also take care of disc herniations. They're probably the most common problems that we see in clinic. And so these patients will come into the office with horrible pain down their leg, sometimes with weakness. And depending on what the MRI shows, we talk about doing things like a microdiscectomy, or ways of taking the pressure off the nerve and taking that fragment that's pushing the nerve out.
Patients typically see us with nerve pain primarily. Very common to see patients with neck or back pain. But what drives surgery usually is compression of neurologic structures. Typically, patients will present with arm or leg pain. That's referable to the back or the neck, and subsequently would undergo surgery to decompress those nerves.
So the first thing when a patient sees me is establishing a diagnosis, finding out what's wrong. A lot of that's done in the clinic with my history and physical. From there, I'll typically order imaging, so like an MRI or a CAT scan. And once we've made a diagnosis, the question is whether or not the patient has a surgical problem or a non-surgical problem. But typically, even if they have a potential surgical problem, we'll try to avoid surgery. And so we'll send the patient for conservative measures like physical therapy or injections or chiropractic care, ways of avoiding surgery. If that fails, then we discuss with the patient what surgery means, what it means to have the surgery, the time spent in the hospital, what to expect, and then what the recovery is like. And if all things are explained to the patient and they want to have surgery, then at that point we begin the scheduling process.
The largest benefit of having spine surgery available in this community is that obviously people won't have to leave the community to get the same care that they would be getting in a larger center or a larger city. Doctors prefer for them to stay local if they can, and having the capability to do complex surgeries in this setting and in this city allows them to do that. For me, to be able to deliver care to people in their own hometown, it's gratifying to be able to create lasting relationships with patients, and having them in the same town where we're doing their surgery allows that to happen.
So the O-arm is that image-guided system that helps us with fusions. Essentially, you can think of it like an intraoperative CAT scan, where basically we can take a picture of the spine once the spine's exposed, and at that point, using different probes, we can guide our instrumentation where we know at that point where it is in time and space, and we can safely insert the instrumentation into the proper structures. The advantage also with the O-arm, especially on complex cases that are redo cases, is that the safety involved with decreasing the time in order to place the screw. Once the instrumentation is placed, we can get a final image confirming that we placed it where we wanted to place it.
The most unique aspect of the Spine Center at Uniontown Hospital is the fact that Dr. Aguilar and I have different training with the same outcome. What we have here is a fellowship-trained orthopedic spine surgeon as well as a neurosurgeon trained in spine surgery, and we're able to work together to provide the best care, combining the advantages of each of the different specialties. Surgery will be the same whether it's performed by an orthopedic spine surgeon or a neurosurgeon, but there are differences in the training that can enhance the care if a collaborative approach is taken.